The number of new COVID cases here in Massachusetts more than doubled from a week ago. And here to answer your questions about that and so much more is Dr. Todd Ellerin, Chief of Infectious Diseases at South Shore Health. Good to see you, Doctor.
Great to see you, Dr. T. So let's take a look at that data. Public health officials released the weekend count of new infections on Mondays. And again, it's a weekend count, so it's a handful of days. But that number has surged from 5,500 to more than 11,000 in just 1 week. So what do you think is triggering? Could Omicron be could it be that the reason for it?
Nice pronunciation, Ed. The answer is no. Omicron is not the reason for this. This is a Delta surge. I know this because I recently talked to the head of the Department of Public Health. And in Massachusetts, we're doing a really, really good job of sequencing. Now, don't get me wrong. There's more than a single case in Massachusetts right now that's gone undetected. But the surge right now is Delta.
That's so interesting.
Yeah.
So what kind of impact is this sudden increase having on hospitals like South Shore?
This is a big deal, Maria. Let's put it this way. As of a month ago, when you look at hospitalizations, they've doubled in Massachusetts. We are seeing more cases of COVID right now in the hospital. And as opposed to past surges that have just gone up pretty quickly and come down, we're seeing a real slow increase. The concern is we're not just having a surge in COVID cases. We have a lot of patients in the hospital with non-COVID issues. We don't have the same capacity as we had last year when there were less patients coming in with COVID. So the concern is that you have sort of twindemics, COVID cases coming in, non-COVID cases, and the concern is the increase could exceed hospital capacity.
Dr. T, some questions from our viewers now, okay? Let's start with Lori. She writes, I received my second shot of Pfizer in January and a third shot in June because I'm immunocompromised. Do I need to wait the full 6 months before I get the booster? Obviously, she's not in that time frame quite yet.
That's right. So the interesting part for immunocompromised patients is immunocompromised patients don't have to wait that 6 months that immunocompetent patients do. So if you're immunocompromised, the recommendation from the CDC right now is you get your first dose, your second dose 3 to 4 weeks later, and you can get your booster 28 days after, so really month 3. If you've waited beyond that, go get it immediately. Immunocompromised patients don't have to wait 6 months.
Got it.
Interesting. All right, this is another one, Doctor. This is from Tina. She writes, if a person had an allergic reaction to the first dose of Moderna, is there a way to get a second dose and a booster shot in a supervised setting? The reaction involved swelling of the neck, but no shortness of breath.
Absolutely. I'll give you an example. I have patients like this, and what we do is we bring them into our ambulatory clinic within the hospital, and we'll give it to them in a setting that is supervised, where we're able to take care of allergic reactions. I think what's important, though, is you want to talk to either your primary care provider or an allergist specifically to make sure that it's okay that you receive that second shot. Obviously, if you've had the most severe allergic reaction, like anaphylaxis, then we're not going to give you that second shot. We're going to go potentially with another type of shot.
Dr. T, do you suspect that the increase in numbers that we're seeing is, Thanksgiving was a period of time ago. Is this in the wake of what happened during Thanksgiving? Do you suspect the timing is that?
At this point, we could be seeing a Thanksgiving surge, Eddie, and with another holiday coming up, with Delta surging, winter coming, this is a recipe. And by the way, it's not all about COVID. We're seeing increasing cases of influenza and other respiratory viruses.
We should make
so
that
don't
clear.
forget to get your flu shot as well.
Yeah, that's a great point, Dr. T.